Well, hello, everybody, and welcome. We're glad you're here tonight to this production of the Biblical Finance with Natalie Tilson. Natalie's been coming and giving us some great insights from God's Word about what the Bible says about finance. And Natalie, there's just so much in there. I never realized how many scriptures there are pertaining to finance and how much finance controls our life.
Exactly, Scott. Yes, you're exactly right with that. God does have a lot to say and guide us if we would just listen.
That's right.
And follow
Yeah.
Him.
So what do you have for us tonight? What direction are we going in tonight?
Well, tonight, Scott, I wanted to talk about, we've been looking at debt and ways that we can control our expenses better, get out of debt and things like that. And hopefully it's helping some people to, look at things
yes.
and really try to knock down some of that debt. But, Scott, sometimes things in life just happen and they're unforeseen. And tonight, what I wanted to look at was when we have a medical emergency that's unforeseen, and then all of a sudden we end up with some large doctor bills, hospital bills, etc.
So this is a lot more than just the emergency fund that we talked about. It's very important to get 2 or 3 months there in an emergency fund that we can get our hands on pretty quick. This is something major with our medical and our health.
Exactly, because I think a lot of times people do not think about planning for these type of things. Of course, best practice is, like you say, to have money set aside always, for deductibles, co-pays, or anything like that. But in a case where we have people that have a lot of medical debt, large debt, want to look at some of the ways that maybe we could potentially reduce that.
Okay.
And just hopefully shed some light on that for some people. So first of all, when we find that we have a large bill to come in the mail after an emergency, maybe a hospital stay, something along those lines.
It's not a good day.
That's not a good day.
We're glad to be out of the hospital, but they're pretty quick usually. But sometimes it's later, and that's a big surprise too.
Exactly.
If you get something like a year later or something, that's not a good surprise, but yes.
Yes. So the first thing that I want to encourage people to do is to check their bill. A lot of times I think people just assume that, okay, well, here's the bill, I owe it, and the anxiety goes up and everything like that. So what I think people should do, number one, is to contact the billing department of the provider, the hospital, or their doctor's office, and ask for an itemized billing from your provider, from the billing department. And to explain what that is, it's just in more detail of all the items you've received. So like if, for instance, say you've been in the hospital, you should have a charge for room and board for each day. Of course, you're going to have, if you've had various tests, so forth, all that's going to be on there. All of your supplies that you've received.
They peel off those little stickers and put them on your chart.
Yes, and do the little scan, and that automatically charges you. You want to look over that because a lot of times you will find that mistakes have been made.
Yeah.
Hospitals, doctors, they're human.
Right.
People are human and they make mistakes.
Sometimes meds change.
Exactly.
But they may be on your billing that you received them when you did not.
Exactly. Yeah. And it may be that they've charged you for the wrong test or something like that. So there could be mistakes on there.
There's a lot of coding, things that I don't understand, but having this itemized billing statement, I think, would really help you and put it in layman's terms a little bit more where you could understand it.
Exactly. Make sure that your dates with your room and board from the time that you went into the hospital until the time you were discharged, that everything's correct.
Right.
So those are things that people really need to do their part in checking. And of course, we want to make sure that all of our insurances have been billed. A lot of times the intake department, the admissions department, they may have messed up a number on the insurance card. That happens a lot.
And even with one of my last surgeries, the anesthesiologist, I asked, the nurse, the people that were checking me in, if it was covered, and they said yes, but it was not.
Exactly.
And so I found out that all that's on me.
Yes.
For pre-medical check. So you have to really take your time and make some phone calls.
Exactly. Yeah. So we have to do a lot of work ourselves
Yes.
to check into all of this. So we want to make sure that they've received all the correct insurance information, billed the correct insurance. If there's any secondaries, we need to make sure that those secondaries have paid.
Good point, yeah.
And things like that. We just really need to make sure that all the insurance has paid.
So the
before we-
secondary insurance would be like if my wife worked as well, so
Could be.
mine could be the primary, hers would be the secondary,
Right.
or the church or whoever, wherever you're employed, so.
Exactly.
Okay.
You may have a secondary that would cover some of that. Also, we need to make sure that we're checking with the insurance company. Ask for a summary of benefits and coverage.
Okay.
That's very important to go along with your plan so that you understand what all is covered with your insurance plan. And when you do that, also ask for a copy of a glossary of healthcare terms, because this can get very confusing. So you want to understand, as you're looking through that summary of benefits and coverage, that you understand all those different terms that they refer to. And this way, you will be able to compare this along with your EOB, explanation of benefits, that you receive in the mail. And you can look to see, compare that with your itemized billing, see what your insurance actually covers, and make sure that everything's been paid by your insurance appropriately to your provider.
Okay.
And then after that, if we find that there is a discrepancy, that maybe the insurance denied something on a claim, then we need to, call the insurance and discuss it with them. Hey, I'm showing that on my plan this should be covered, but it looks like it was not paid, and discuss that, because from time to time we will find that sometimes insurances, they make mistakes as well.
That's right.
And like you said, Scott, with coding and so forth, perhaps they have just paid inappropriately
Right.
or something.
And sometimes you feel like a ping pong ball, but you've got to be persistent because you're talking about thousands of dollars.
Exactly,
Right.
exactly. And like I said, they do make mistakes. And if you feel that you do not agree with the insurance, a lot of people don't realize this, but you can file an appeal with your insurance company.
Okay.
And you have a course of action that you can take there. And sometimes there's more work that potentially has to be done. You may need to get back in touch with your doctor, your healthcare provider, and they may need to provide further information to the insurance company. Perhaps the doctor did a test or something on you, and the insurance is saying, well, your plan doesn't cover that. The doctor may have to sort of go to bat for you or something along those
Or
lines.
show you the hoops that you went through that you did.
Exactly.
How important is it, Natalie, to document who you talk to while along the way?
You need to document everything.
Okay.
Ask for names, write down the dates,
Okay.
who you spoke to. If you can, get things in writing, of course, that's always
Right.
more beneficial.
Right.
But sometimes you can win an appeal. It may be that your insurance requests further information from the medical records department of the hospital, your provider. You would have to request that be submitted to your insurance company to try to get that covered.
Right.
So there is some work involved, but
Right.
when we're talking about thousands of
That's right.
dollars, a few phone calls, that sure makes it worthwhile.
And at this point of the negotiating stages, we're not talking about needing a lawyer or anything else. This is just us working with the insurance company and the doctor's office. Is that correct?
Exactly.
Okay.
And you do have an appeal process that your insurance should spell out your whole process, and your insurance will let you know throughout that whole process if it's been overturned and they're going to be paying that
Right.
claim, or that if they stand by their decision of denial, and you may have an opportunity for a second appeal and so
Right.
forth.
That's great. That's great
Now,
information.
If you do feel that you're getting a runaround with the insurance companies, that they're just not listening, that they're not doing their part, they're not following their policy with so many days getting an answer back to you, that kind of a thing, You do have a course of action. You can contact your state's insurance commissioner
Okay.
and report this. And insurances really don't like it when the state insurance commissioner gets involved and calls the insurance and says, hey, you're not following your own policy here.
Right.
So.
Wow, that's good to know somebody's in your corner a little bit there.
Yeah,
That's
exactly. So this is something, that if they're not doing their part in getting back with you timely, and you still
Right.
have this bill that's out there that you're disputing the coverage, then you may need to get the state insurance
And
commissioner
another reason to
involved.
have this documented, I think, too, is because, when they threaten you with turning over that to collections, nobody wants that. And, all these different phone calls and things that you get, because a lot of times the insurance company will turn it over to a totally separate collections company.
Mm-hmm.
And so you're giving us some incredible information that I feel like a lot of people aren't aware of and can really help them save, keep money in their pocket instead of
Exactly.
giving it away.
And that's actually a very good segue into my next point, Scott. So if in fact that you see that you do owe the bill,
Mhm.
and you do not have the money to pay for that, you need to see if you qualify for any financial aid. Now, a lot of people do not realize this, but here in the past several years, and this was kind of something done more under the past administration
Mhm.
in the White House.
Sure.
Under federal law requirements for not-for-profit hospitals, which a lot of our community hospitals are not-for-profit hospitals,
Right.
they have to offer financial assistance programs, what are called FAPs, and information on how to apply for people who are uninsured or underinsured.
Okay.
And really, that is to be publicly displayed, what's called a plain language summary, which is
Okay.
just that. That has to be displayed in hospitals and places that are not-for-profit entities like this, so that patients can actually see and understand. It's just that. It's plain language.
Right.
It's not anything that, is really confusing.
Yes, that's so good. Yeah.
So that's why you will see those displayed a lot of times as you go into admissions or places like that. And with this, you can simply call the billing department and explain to them, I've received this bill. I'm unable to pay, but I would like to see if I qualify for financial aid.
That's great. Yeah.
Now, they have to do their part in seeing if you qualify for financial aid. There's a period of time there that's involved
Mhm.
before they can take action. They have to do this to
Right.
see. Now, there will be some requirement on your part as a patient. Normally, you have to supply something like perhaps pay stubs
Mhm.
to show, your level of income.
Right.
You may have to supply a tax return from the previous year or two, or bank statements, things along those lines.
Right.
A financial document. It really depends on the policy that the hospital has set up. So you will definitely want to ask, what do I need to supply to you to see if I qualify for any
Right.
financial aid?
Yeah.
What people do not realize as well is that this is a sliding scale. So some people will say, oh, well, I probably make too much to qualify for financial aid. Not always the case.
Mhm.
You may have a lot of middle income
Right.
people who will qualify, because it's not only based on your income, but it's also based on the number of people in your household.
Okay.
So you might have what you might consider a large salary,
Right.
but 6 kids or something
That's
at
right.
home. You
Yeah.
can still qualify. It may not be 100%,
Right.
might be 75, 50%. It just depends.
That's thousands of dollars again.
Exactly,
Yeah.
it could be.
For taking some time, providing.
For taking some time
information
to know
for 'em,
your
yeah.
rights here. So that is definitely something that you want to look at. Also, some people may be eligible for Medicaid. And for that, sometimes Medicaid will go back retro for a certain period of time. So, I would encourage people to look at Medicaid.gov
Okay.
and just do some searching there to see if they may qualify, if they feel that they are underinsured or whatever,
Right.
and just see what's out there if they qualify
Yes.
for that potentially.
We don't see too many commercials on what you're talking
Oh,
about.
no.
Because I won't say that they don't want you to know, but it's great for the consumer and the people that are on the receiving end
Exactly.
of the healthcare industry to be able to make wise decisions.
And what people also do not know is that with this, because it is something involved with not-for-profits, that they have to follow this and meet these federal guidelines. Otherwise, they can lose their status,
Oh, wow.
their tax-exempt status. So it's very important for hospitals to make sure that they're following it.
great.
But as a consumer, we need to know that this is available to us.
That's great news.
And then finally, if you see that you do not qualify for any kind of financial assistance, you can always negotiate.
Mm-hmm.
And with this, sometimes you could maybe speak with the billing department and explain to them, I'm not able to pay this total amount right now, but could I pay a lump sum right now and see if you can work something out for, okay, maybe I have this $3,000, we'll say, for instance, but this bill, but if I gave you $2,000 cash right now on the spot, would you consider that paid in full?
Yeah, and it's unbelievable how many times they'll agree to that.
Exactly,
Yeah.
because they would rather
Get something
have something up
than nothing.
front.
That's right.
And,
Yeah.
make sure that you receive a receipt saying paid in full.
That's right.
If they agree to
Yeah.
that. Or you can look at some kind of installment payments.
Yes.
And make sure that you have that spelled out, the terms that you negotiate there, how much that would be. And, if you agree to the first of the month, you will give $50, $100, whatever.
Right.
You need to make sure that you are paying that, not
Right.
on the second or the third,
Right.
because then you have defaulted.
That's right.
So you need to make sure that you
And it
stick.
could go back to the full amount.
It could.
Yes. Yeah.
So, you want to make sure that
Yeah.
you have that in writing. And I would say the main thing is just to sit down and explain why you're having trouble paying and be honest, because, a lot of times when you can explain, hey, I've got this bill, I want to do the right thing, I
Right.
want to pay my debt,
Yes.
but I've lost my job due to this injury that was unforeseen. Now I have all these medical bills. What can I do here? I want to do my part in paying. How can you help me?
That is so important, and I think that's where a lot of people, because of fear and being overwhelmed by everything, that's the biggest mistake I think that people make, is they don't make the phone call.
Exactly.
Even up front, let them know with the billing department and stuff, hey, I need to check some stuff with my insurance, just to let you know I'm working on this, and just to let them know, and that makes a lot of difference.
Exactly. Exactly. So I would, like I said to begin with, best practice is to have that emergency fund set aside to cover deductibles, co-pays, or anything that's unforeseen like this. But of course, as we're further discussing budgeting, I know that a lot of people are hopefully working to eliminate that debt. Maybe they're not to the point where they have all their other debts eliminated,
Right.
and they can start looking at setting money aside for unforeseen things. But hopefully some of these ideas may help them to get that debt reduced.
That is great, Natalie. Thank you so much. And this is probably one of the scariest debt issues there is, because it comes up unexpected for one thing, but then the amounts are overwhelming. But as you said, there's a lot of ways that we can negotiate and work through this and be able to lower those amounts in reasonable and lawful ways to do that. And a lot of the hospitals are set up financially to be able to do that and help us. So Thank you so much for this research and for the time, and I pray that this is going to save you a lot of money down the road. We pray that nothing will ever happen to you, but we know that these earthly bodies wear out, and the older we get, unfortunately, the more times we have to spend at the doctor's office. Want to encourage you to live well, take care of yourself, so that we don't have to go to the hospital quite as much. And Natalie, again, thank you so much for your time this evening and bringing this information to us.
Thank you, Scott.
All right, you have a blessed evening.